Let's talk about the difference between CBT and ERP. CBT and ERP are both used to treat OCD. CBT stands for Cognitive Behavioral Therapy. ERP stands for Exposure and Response Prevention Therapy. ERP is a form of CBT. The difference is that ERP is much more aggressive form of CBT. So with CBT, as I described in the earlier videos, you would create a hierarchy of things that scare you from least scariest to most scariest, and as you go through life, kind of face those situations one by one. So you would start with dealing with the least scariest, doing it enough times until it stops giving you anxiety, then move on to one just above that, but still not the scariest, but just below the one just above the one that you just got over. And then go up slowly until you face the situation that you fear the most. But it's done very kind of passively and over a longer period of time, so as not to cause a lot of anxiety to the person. It shouldn't be shocking to the system. It should just get you a little bit on edge so the brain sees it and then calms down, but not huge anxiety. With ERP, it's much more aggressive. So the person is putting themselves in the situation that scares them because of their OCD, and then not giving in the response. So where before they would respond with extreme anxiety and extreme stress, now the person controls that response. And over a period of time, when they do this, they overcome OCD. But the ERP is much more intense. So you wouldn't start from the bottom. You could start from whatever you can handle. But because you are kind of bringing on the anxiety, you're showing to your mind that this is not scary to me. I can handle it. I'm going to do it. And you recover much faster. But at the same time, you will experience a lot higher level of anxiety. So where CBT is something you can kind of do and it's going to be okay, ERP is something you really have to focus on, and you really have to be focused on the result of overcoming OCD, because ERP will not feel good. It's going to be very stressful, very intense. You're going to have huge anxiety, and you're going to think that it was better with OCD than now doing this ERP is even worse. But this is good because this is what you're supposed to feel. This is how you get over it. Would I recommend CBT or ERP? I think they're really both the same thing, but for myself personally, when I was overcoming OCD, I preferred ERP because the speed is very important. I would rather suffer more in the moment and then get over it, say, in 6 months, rather than stretch this out for another year, So, but that's just my opinion on it. If you're in a situation, I was in a situation of low stress when it came to the rest of my life, so I could afford to have slightly higher stress dealing with ERP. But if you're in a situation of already high stress with jobs, family, all of that stuff, I would not recommend ERP because you don't want to be in this level of stress. So if you're in that situation, I would probably recommend CBT. They work both fairly well. The problem with both of them is that once you're done the therapy, whatever it is, CBT or ERP, you will overcome the obsession. That's not a question. You will overcome it. As long as you do everything correct, you have a competent doctor, you'll be fine. But after that, you have to know that you're not really over OCD. You're just over the particular obsession that you've started out with. So if, say, your OCD switches to something else, which it commonly does for people, you can start at square one. Because what happens is your OCD switches to a different obsession. You react to that obsession with extreme fear, extreme stress. Then you start to think about it some more. It becomes like a snowball effect again. And you can end up in the same situation, say, a year from this time, needing ERP or CBT for now your new obsession. And this can go on endlessly. So what you need to know is, once you're over your particular obsession, always be on the lookout for something else coming up. And if and when it does come up, stop it before it takes hold, because your brain is used to a high level of anxiety. You're dropping that anxiety by, doing the therapy and overcoming OCD. So, but your brain is not over it. Your brain is just looking for another topic to attach itself to. So be very conscious of that and know that it's going to take not a long time, but it's going to take a little bit of time for your brain to click in that this is not a normal level of life of, this high of anxiety. So until it does, just be on the lookout for things and don't get yourself emotionally attached to things that other people who don't have OCD wouldn't get emotionally attached to. And always know that if it happens again and, you kind of drop the ball on it and get into another obsession, you always do have ERP or CBT to pull you back out of it. But, you just don't want to be doing that after doing all that work. And after a while, your brain will understand that, okay, he or she, they're not buying this situation, they're not buying that situation, they're not falling for this, they're not falling for that, and then it's going to continue to drop until it just goes back to normal, and then you will for real overcome OCD and not a particular obsession. But like I said, it does take time, so just be very conscious of these points that I've made in the video, and please do your own research. Go online. We have Google. Go online, research this, and as much information as you can gather for yourself, it's going to better your recovery. You want to be informed. You don't want somebody else to be leading you. You don't want to just listen to me. You don't want to just listen to your doctor. Listen to all the sources. Make your own decision, because it's your life. It's your health. You are the only person who is responsible for it. I hope this video has been helpful to you. If you like it, please click thumbs up. If you have any questions, email me at info@youhaveocd.com. If you just have a quick question, you can post it below the video. If you don't mind other people looking, if you want it to be private, you can send me a message even through YouTube. I do answer all of my emails. It might not be right away, but I do answer all of them. And please don't forget to subscribe. Thank you and have a great day.